We get this question from people that watch some of these videos is, what should be the first couple things that a person does when they get that diagnosis? I mean, panic and fear often set in, but what would you recommend that people do?
Well, the first thing is I would always read The Hitchhiker's Guide to the Galaxy and don't panic. Seriously. Bad geek reference, I know. But there's not a reason to panic. I mean, I see patients sometimes that have really high numbers who've not been monitored at all. Men come in with a PSA of 3,000, and that's a different story. But if a man's PSA is under 10, which most men are when they get this, don't panic. Just quick, PSA under 2 in most cases is not cancer. A PSA over 10, most cases is cancer, but not always. Between 2 and 10 now, unofficially, is no man's land. Doesn't mean anything. It just means we need more information. And usually something else comes up in the story. That's what I found over and over. You know, you got a Harley Davidson you didn't tell me about, and that's usually, you bought the Harley and all of a sudden the PSA went up. I mean, I see this all the time. So you need to have a doctor to take time and really get under the kind of, as I say, under the hood to work this through. Second, many men will take antibiotics. Now I know, I don't like the pressure with antibiotics, but some way of reducing an inflammation or an infection and then retest the PSA over time, that could help show whether or not the PSA really is up for the right or wrong reasons. If you're asking if someone was diagnosed with cancer specifically on a biopsy, still, same thing, would not be panicking because, as I said, we have cancer in us all the time, or at least we suspect that. And so a cancer may not be an issue. Let me give you one little quick case study that I mentioned to physicians and might answer this question about not panicking. I gave a speech at actually it was the Mayo, and there was a woman who was there who heard me, and she decided to bring her husband in. Her husband thought it would be a waste of time because he was diagnosed with prostate cancer and he had a PSA of 15. So what's there to talk about? I'm going to waste this money. He sounds like a nice doctor, but I'm going to waste the money. So she dragged him in anyway. He was Polish, I'm Polish, so at least we talked glumkies and pierogies and we had something to talk about. But he came in and I said, okay, let's talk about this. I said, how did you have cancer? Well, my PSA, I got a biopsy. Why? My PSA was 15. How did you know it was 15? Well, the doctor pulled it at the ER. I said, the ER? Why are you in the ER? He said, well, because I couldn't urinate. I said, why couldn't you urinate? He said, well, I bought my first Harley Davidson when I turned 50 in a midlife crisis, a little late, he said, as a rich dentist. And he decided, when he got his Harley, to do a Dennis Hopper from Easy Rider. And he wanted to go cross country from California to Maine. Well, he made it as far as Chicago, at which point his prostate seized up. It's like a Charlie horse of his gland, one of these. And he couldn't urinate. So in the emergency room now, he's got a seized up prostate. And imagine a sponge that has water in it, and you squeeze it. Imagine all the water that shoots out. That's the PSA, getting squeezed out into the body. But it gets better. The ER nurse took a catheter and shoved the catheter up his penis through the prostate and had to shove it through. That increases the PSA. So at this point, all they looked at was one number. One number again, making a judgment call. No one asked him how he got there. They didn't ask what he did, none of that. And that triggered the biopsy. They did the biopsy. They found cancer. I said, let me see the biopsy report. They normally take 12 cores. They found cancer in only one of the 12 cores. And of that core, they found it in less than 1% of the one core. And of that, they found a Gleason 6, which is the weakest cancer you can have. So a Gleason 6 of less than one core, that's not cancer, that's a joke is how I would see that. But then I simply asked one last question. I said, do you happen to know what your PSA was before the trip? He said, matter of fact, my wife, because we almost divorced over the motorcycle, made him get a life insurance policy before the trip. Smart lady. It turns out 1 week before the trip, his PSA was 1.4. So 1.4 to 15 in a week, that's not cancer, that's called a hog is what that is. And that is an example of don't panic. You know, you never know, but I've seen too many of these stories. Once you get used to you get more comfortable with these lower PSAs under 10, under 20. And cancer doesn't really mean cancer with a capital C. In most cases, it's a lowercase c.